Welcome to the Home Health Minute, your monthly podcast brought to you by the Home Health section of the American Physical Therapy Association. Hosted by Troy Mead. Hello and welcome to the Home Health Minute. I'm Troy Mead. Today we start looking at some of the resources that are available from the Home Health section. And today we're starting with the sleep resource, Sleep Management in the Home. So please join me as we talk with the creators of these resources, starting with Sleep Management in the Home. So today I've asked Katie Siengsukon, PhD, PT, come to talk to us about a little bit about the sleep resource, Sleep Management in the Home. And Katie is an associate professor at the University of Kansas and director of the Sleep and Health and Wellness Lab in Kansas by the Rock Chalk Jayhawk. So welcome, Katie, and thank you for joining us.
Thank you for having me. I'm excited to talk with you.
Can you tell us a little bit more about yourself and where your interest in sleep come from?
Sure. So I'll kind of give the abbreviated version. When I graduated from PT school in 2002, when I graduated from Rockhurst University, I practiced full-time in an outpatient setting. And I honestly was surprised at how many of my patients reported sleep issues. I was treating them for various conditions, and without fail, lots of them would report having difficulty sleeping. And I really didn't know what to do with them. I didn't know what to tell them. I didn't know how to assess them. I would usually kind of focus on positioning techniques that maybe would make them more comfortable to sleep, but that was really kind of all I knew for what to do. So that kind of is really what kind of piqued my interest. And then when I decided to go back and get my PhD, I did my PhD at University of Kansas Medical Center with Laura Boyd as my primary mentor. And she's very interested in studying factors that influence motor learning and recovery in people with stroke. And so at that time, there was a ton of evidence that while you sleep, what you learn gets consolidated. Basically, it gets strengthened. And so it was a kind of a natural pairing between her interest in factors that influence learning and people with stroke and my interest in sleep. And so that's really what my research started as, is understanding how sleep impacts learning and recovery in people after stroke. And the more I dug into sleep, I really quickly realized that yes, sleep is very important for learning new information and learning new skills, but it also dramatically impacts our health. And pretty much every body system, from our cardiovascular system to our immune system to our metabolic system. So that really gave me a much better understanding just how critical sleep is for our overall health and wellness. And again, it just went back to that. I feel like it's something that we as physical therapists, are in a very prime position to screen our patients, do basic sleep health promotion techniques. And I think that would have a dramatic impact on our patients' recovery and their overall health. And so that's really become my passion, is to spread the message about what is it that physical therapists can do to help our clients improve their sleep.
And that's kind of what led you into creating this resource.
Absolutely. Yeah. I had written, my lab had written a perspective paper that was published in Physical Therapy Journal last year. That was really about practical application for physical therapists on how to screen and promote sleep health. And so Ken Miller, who is the chair of the practice committee of the Home Health, we had connected on Twitter. And so he reached out to me last summer and asked if I would have any interest in partnering with him and with the committee to develop this resource. And I immediately jumped at the chance because I really saw it as a great opportunity to kind of get that message out there to more physical therapists and more healthcare providers in general. Really, what is it that we can do that's within our, scope of practice, but also to make it accessible, because I think a lot of times, PTs and other healthcare providers think, gosh, I'm already so busy with doing all these other things. How could I possibly do one more thing? And so we really wanted to make it very usable and very, much something that, it's kind of simple to use, or simple as we can make it, so that it ideally, just kind of fits into what we're already doing within our clinical practice. So it's not a whole lot more work, but could potentially have, again, a big impact on our clients' health.
Yeah. I think we all kind of know generally that sleep is important for our patients. but I think it's, like you said, it's kind of hard to have kind of some kind of, intervention or address that with our patients. So I think this, looking over this resource, I think this really, can really make an impact and really kind of help a lot of the clinicians who know that's an issue and just don't know how to address it or where to go with it. And,
right. And I mean, and it was really Ken's idea to put together that decision tree that's in the resource, because in that perspective paper that I wrote, I kind of discussed about, some of the different screening tools that the physical therapist might use, or some of the questions that you might use to screen for possibility of sleep issues. So it's like, yeah, here's all these questions you could ask. Here's all these, questionnaires that you then could use if needed. But he was like, let's develop some sort of a decision tree, to really guide the therapist on, if based on this answer, then where does that take me, and what's my next question, and then how do I know which surveys then to move to, and then based on the answers of those, how do I know, kind of what to do with that person? Do I need to refer them to a physician for further testing? Can I educate them about ways to promote sleep health? So again, to really take that information that, yeah, I mean, it's out there, but to make it, digestible and really, usable for the physical therapist.
So that kind of leads me into my next kind of question. You kind of mentioned about the decision tree. What are we going to find in this resource for the clinicians?
Right. So we structured it so that there is a decision tree. So, there's these questions that we encourage you to ask all your patients. And then based on those responses, it kind of takes you then to other kind of decision points. So it really walks you through, here's the questions and here's what you do about it. Here's then the questionnaires that you could ask. We know that insomnia, obstructive sleep apnea, and restless leg syndrome are the three most common sleep issues in adults. And so I don't expect physical therapists to be experts in every single sleep disorder. But I think we should be able to at least recognize or be able to screen for those three most common ones and know when it is appropriate to refer. I think it's also important for us to know just, general assessments tools to look at sleep quality. So if we know if, someone has terrible sleep quality, what are things that we can do to help improve that? And if our PT treatment, for whatever reason we're seeing them, with these sleep hygiene or sleep promotion techniques, if that's not improving that sleep quality, then again, it's probably time to refer them to a physician for further workup. So there's that decision tree. Ken Miller then put together a table that includes information about different medications that may impact sleep. Knowing that the home health physical therapist, are very good at, looking over medications and just taking into that consideration that various medications can, in fact, impact somebody's sleep. And then we also, the third part of the resource is really just those practical things that physical therapists can do to help promote sleep health. And I think, again, I don't expect physical therapists to be experts. There's experts that are trained in doing, more specific sleep interventions like cognitive behavioral therapy for insomnia and those sorts of things. But I firmly believe that we can educate all of our patients about general sleep hygiene techniques. Things like going to bed and waking up at the same time. Stimulus control is another big one. So you should be in bed for sleep and sex only, and everything else is done outside the bed and preferably outside the bedroom. I think especially for the home health therapist, because you're in the home, you have an awesome opportunity to really see where the client is sleeping, and kind of make those recommendations on, oh gosh, a lot of light is coming into your bedroom. You might think about, curtains that could block out the light, or, a sleep mask that could block out the light. Talking about the bed and checking even for bed mobility. We are constantly changing positions during our sleep. And so if you're not able to roll in bed or get in and out of bed very easily, you're much more likely to, come more fully awake and have more difficulty sleeping. So it's I really saw this as a great opportunity to be like, wow, these are therapists that are in the home and really, again, have a great opportunity to assess that environment. I think another thing that physical therapists kind of have, an awesome opportunity is the potential of preventing sleep issues from happening. I think we often think of, people have sleep issues because they have some sort of a diagnosis, right? Or they're in pain, so that's causing their sleep. But we also know that if you have sleep issues, you're much more likely to develop chronic pain 10 years, 5 years down the road. So, what if we could, educate our patients early on of, here's the things that, maybe you're already doing all the sleep hygiene stuff really well. Now keep doing that in the hopes that it prevents, future issues from developing down the road. So that's, I think we have a role definitely in addressing sleep issues, but then also I think preventing sleep issues from developing.
Mm-hmm. Yeah, I think that's one of the strengths of this tool. Like you said, you listed everything that's in it. I think it has a spot for the patient that, like you said, you can get on that doesn't have a problem yet, but may have to. So you get that population health side, the avoidance side, as well as, screening tools on when to kind of refer out when they need, obviously, like you said, we're not going to be sleep experts, but it's something that we can address, and it's something that we can screen for and look for and get our patients to the right level of care when it comes to sleep.
Absolutely. I mean, like sleep apnea is a great example of that, we're not going to treat sleep apnea. And I wouldn't expect that a physical therapist would. I mean, that individual is going to need to see a sleep specialist to be diagnosed and to be put on whatever treatment is needed. But I think we certainly are in the role of screening people for having sleep apnea because we know that sleep issues, particularly sleep disorders, largely go undiagnosed. So again, what a great opportunity for us to identify those people early on and refer those to the appropriate professionals, and then do what we can within our scope of practice as far as promoting sleep health.
Exactly, yeah. We have a unique opportunity as therapists because we get to spend a lot more time than other professionals with our patients, that we can always be more on our toes and, looking for other things that, if you're treating the patient as a whole patient, what's their issue and do you need to refer out?
Absolutely. Well, I think knowing that sleep is important for, tissues to heal, it's important for recovery. So if our patients aren't sleeping well, they're likely having delayed recovery as well. Not to mention all the stress that it's putting on other body systems as well, and potentially, contributing to the development of other conditions. So yeah, I think you said it perfectly. We really are in that prime position since we do see our clients for the most part on a somewhat regular basis, at least initially, to kind of be those people that can identify those issues early on.
So what would you say to the therapist that's still unsure whether sleep's something that they should address and that's important for them to address in the home?
Yeah, I mean, I think I can certainly understand, that perspective of, there's so much that we have to do and so much, documentation we have to do, and we're all pressed for time. I mean, I really do. I understand that. But I think really, reiterating just how critical sleep is for health and recovery. And we're really, if we're not talking to our clients about sleep, I mean, we're really missing a huge piece of the puzzle. And I would argue that we're doing our patients a disservice by not talking to them about sleep. Sleep is going to, really impact their ability to even participate in therapy for that matter. So I think just knowing just how critical sleep is for health and wellness and recovery and all those body systems. But I think also recognizing that it doesn't have to be, a very time intensive, practice that we, start doing as far as the screening. We piloted the screening tool in 3 physical therapists. And by the time they had done it in 3 to 5 patients, they were reporting that it was taking them 5 minutes to get through, which, I know 5 minutes can be a lot, but, 5 minutes to do a thorough screening, in the hopes that it helps our patients in the long run, I think is, kind of a 5-minute good investment, I would say. And I would also say that, you could probably even get through at least, the beginning parts of the questions to just give you a basic idea of what is their sleep quality like. So at least it's in the back of your mind So maybe you don't make it through that whole screening tool, on your first visit, but maybe it's something that you can kind of incorporate in, as you're doing other things, or, as you have other visits as well.
So as great of a tool as this is, what if someone wanted to learn more? Is there other resources that I could go to or seek out?
Yeah, so again, we wrote that perspective paper that was published in PTJ last year, and we really wrote it for the physical therapist. We think it has a lot of good resources in there, a lot of good information. I think that's a great resource for therapists as well. There's also a perspective that was just published in PTJ just this month, I think, from a group in Belgium that's specifically about sleep issues in people with chronic pain. And that, again, is a really great resource. There's also, information on websites. National Sleep Foundation has some good information. The Centers for Disease Control and Prevention has some good information. The American Academy of Sleep Medicine also has a nice website with some easily digestible information. So I think those are all some different resources that could be useful as well.
So I'm going to try to find the abstracts for those articles and try to put them down in the notes for the episode. But I highly encourage everybody to go to the Home Health Section website and download Sleep Management in the Home, because I learned a lot about sleep just going through it. There's a lot of information, and it can be so impactful, I think, on your practice, especially on those patients that are having a lot of those issues that I don't want to say difficult, but the harder to manage patients that are having issues that it might just be a change in their sleep patterns or something that can help get them over that hump, and really, like you said, 5 minutes in your day to day, sometimes it may feel like a lot of time, but 5 minutes to that patient and that, is invaluable.
Mm-hmm. Absolutely. Well, I'll leave with a little story if I can. Is I'm doing a study with cognitive behavioral therapy for insomnia. So I've been trained in that technique, and I'm doing a research study in people with multiple sclerosis. And it's a 6-week program. I see them once a week for 6 weeks. And this woman with multiple sclerosis, we're talking about her sleep issues, and I was also then kind of talking about like nutrition and exercise, because again, I think sleep is definitely, I think, a centerpiece of health, but as our nutrition and exercise as well, stress management, and she looked at me and she's like, you are the first person into the 10 years that I've been diagnosed with MS that has actually asked me about sleep and has treated me like a whole person. The neurologist only asked her about her medication. The physical therapist that she'd seen off and on was really focused on her balance, and that just really struck me. It mattered to her that we were talking about her sleep. And it mattered to her that we were, problem solving ways for her to sleep better. So, I'll just leave with that story that, it is for a lot of people a really important piece of their lives and I really think it's something that we as therapists can have a big impact on.
Well, Katie, I wanted to thank you again for joining us and for all the wonderful work that you've done on this resource.
Well, thank you for having me. If people would like to reach out to me as well, you're welcome to email me. You can reach out to me on Twitter. I'm at Katie Sleep PT. I absolutely love to talk to people about sleep, so feel free to contact me if you'd like to dialogue more.
Thank you for listening to the Home Health Minute, the podcast from the Home Health Section of the American Physical Therapy Association. Check out our website at www.homehealthsection.org. There you can find links to this episode, tons of helpful resources for your practice, and how to connect with us on social media. Thanks for joining us, and we'll see you next time.